Go.
To begin this part, the assessment, briefly inspect and palpate the external part of the patient's nose. It should fairly symmetrical with no lesions, deformities or deviations.
Go.
Now we proceed to application test. This is done especially if the patient reported any problem of his sense of smell during the health history. To review this is to test the olfactory nerve by having him identify specific smell. Okay, sir, I want you to open one of your nostrils again and close your eyes. And I have sometimes I want you to identify the smell and tell me what is it.
Petroleum jelly.
The number of findings is that the patient should be able to identify the specters frequently.
Oh.
Since we don't have any otoscope or equipment, we just explain the procedure. Next, inspect the nasal cavity using an otoscope. With a short wide tip speculum, to widen the nostril, apply gentle pressure on the tip of the patient's nose. With your thumb, then tilt his head back slightly and insert the speculum gently into each nostril. Avoid contact with the sensitive nasal septum. Hold the otoscope handle to one side to avoid the patient's chin and to improve your mobility. Direct the speculum towards the back of the nostril, then move it upward in small increment to view the nasal cavity. You should see coarse hairs lining the anterior surface and ciliates membrane. Lining the posterior surface throughout the nasal cavity, the mucosa should appear pink and moist, and you should not see lesions, drainage, or obstructions. Now inspect the nasal septum and note any deviations, inflammation, or perforation. Remember though, that deviated septum is nasal or is normal unless it's obstruct airflow finally. Inspect the turbinates, which are located laterally. They should be lighted red without any swelling, exudate, epidermis, or polyps. Now ask the patients to bite down and bare his teeth while you assess the jaw alignment. The front of the mouth, his upper teeth should override the lower teeth slightly. Before examining the mouth, ask the patient to remove dentures if he is wearing one. Inspect the patient's lip. They should be moist with normal color. You should not see lumps, ulcer, cracking, or scaliness. Ask the patient to close his mouth. The lips should close symmetrically. If you see any suspicion lesions, palpate the lips, which should not feel soft and smooth. Be sure to document abnormal findings. Then assess the oral mucosa using. Normally, the mucosa is pink, smooth, and moist with no lesions or nodules. Remember that in a dark-skinned patients, you'll commonly see increased mucosal pigmentation. Next, assess the patient's teeth and gums. Normally, adults have 32 evenly iron-colored teeth that are firmly embedded in the gums. Inspect the rest of the oral cavity. The hard palate should appear bony, whitish, should look muscular and pinkish. The alveoli should be pink, midline, and free of lesions. Next, inspect the tongue. Dorsal surface should be symmetrical and slightly rough with a midline groove and small fissures. The ventral surface should be smooth and pink with visible veins. Using a gauze pad, hold the patient's tongue to one sided and palpate the floor of the mouth. You should feel no lumps or dirt.
Oh.
Next, ask the patient to split out his tongue. It should be midline and free of tremors. Place the tongue blade at the side of the tongue and ask him to push it away.
Stick it with the tongue, sir. Push it away with your tongue.
Tongue pressure should be equal on both sides. This action is tested by the hypoglossal nerve. Check the glossopharyngeal and vagus nerve by depressing the tongue and having the patient say ah.
Say ah. Ah.
Oh.
Instruct the patient to say ah again and assess the pharynx tonsil. Your mucosa should be smooth and pink grade the tonsil size on a scale from +1 if the tonsil are visible, 2 plus 4 if they could touch each other. If the patients reported an impaired sense of taste during the health history, assess his facial and glossopharyngeal nerve by having him identify a different flavor.
Orange. Orange.
Orange. And then light touch the back of his tongue with a tongue blade and he should gag. Okay. This test access the glossopharyngeal vagus nerves.